Dr. Freeman, Dr. Somani, thanks so much for those excellent presentations. We now have about 15 minutes for the questions from our audience. We've already gotten some great questions, so I really would encourage you just type your questions in. The other audience members will not be able to see them, but I will as the moderator, and do please ask your questions. So I think the first question I will share with Dr. Somani. Are there any vaginal lubricants which don't include estrogen?
Sure. So vaginal lubricants actually are the first line treatment that we would recommend to somebody who is having pain with intercourse. And they are over the counter. They are products that people can buy themselves. There are many different kinds, as I mentioned, most commonly water and silicone based, and none of them have estrogen in them. The only products that have estrogen are the ones that you would need to get through a prescription.
Perfect. This next question is for you, Marlene, and it's really from me. I know you're doing a really important study on midlife depression. Would you please tell us a little bit about it and how women might be able to get involved if they're interested?
Thank you for asking. We're really excited about a treatment study that we're doing with a novel treatment for women who are either perimenopause or early menopause. It's funded by the National Institute of Health and specifically the National Institute on Aging. And we're looking at a novel treatment called pregnenolone, which is a neurosteroid. And if you have not heard of neurosteroids before, I'm not surprised, but they're a very new and upcoming new class of medications that's being studied primarily as antidepressants. So they're being studied, really the leading edge has been in postpartum depression. They're also being studied in major depressive disorder in men and women, but may seem to play an especially important role for women. And so some of the preliminary data suggest a more robust response in women than men for the treatment of depression. So what we're looking at are women who are experiencing major depressive episodes, so at least a couple of weeks of feeling down or depressed or losing interest or pleasure in things with other symptoms, so a major depression, plus menopausal symptoms such as hot flashes or other symptoms. And we're looking at not only the effects on mood and depression, but also anxiety, sleep, cognition, and these are all things that women are really struck by as being so difficult during the midlife years and the menopausal transition. So it's a treatment study, and women are compensated for their time. So there's a minimal number of visits in person at MGH, and most of the studies were changed to be remote at the onset of the pandemic. So we're trying to aim for the least amount of burden of people's time, but also compensating people for their time. If you want any information on this study, you can see our research page, which is on our website, which is www.womensmentalhealth.org. And I believe we can also put that website in the chat. So I don't know if that's, I believe it's already been posted. But if you're interested in this study, either yourself or want to pass along the information to someone else, we'd be very grateful.
Thanks so much, Marlene. A question back to Sujata. Sujata, the question is, tell us a little bit about what is vaginal rejuvenation?
Sure. So vaginal rejuvenation is sort of marketed as such, and people are generally using laser, typically the Mona Lisa laser, which is a brand name. And what they do is they laser the inside of the vaginal tissues, which creates small cuts and increases the collagen content of the vagina, as I mentioned in my talk. However, it's also sometimes marketed as being used to tighten the vaginal tissues, which really doesn't work. The other thing that I mentioned in my talk as well is that vaginal laser has really not been proven to be effective for the genitourinary syndrome of menopause. There was one study that was done that did not show any significant benefit compared to placebo. That doesn't mean that people are not offering it. It is very expensive. It's not covered by insurance for the most part, and is at this point not FDA approved for this indication.
Thanks so much, Sujata. For you, Marlene, what about using marijuana for menopausal hot flashes, menopausal mood symptoms? What are any information on that?
So we hear this all the time from patients who want to know, should they try using marijuana or cannabis products for mood or anxiety symptoms, or specifically menopausal symptoms? And we just don't have data to support that. I think there's often this um, seductive draw to using marijuana or cannabis products because they've become much more popular and destigmatized with legalization across many states. So what we really want people to know is that it's not well studied for any psychiatric indication, and some patients may actually feel worse. So we really want to discourage patients, especially if they're already on treatment, from stopping standard treatments to use marijuana instead. And that's a question we get all the time. And just to keep in mind that the research hasn't been done. There's actually some research, particularly among young adults, that suggests that there might be worse mental health outcomes if marijuana is used. So, sort of worsening the risk over the lifetime. So the answer is we don't know what the potential therapeutic use of cannabis products might be, but we just don't have any data to support that at this time.
Great, thanks, Marlene. For you, Sujata, there's a question. I think that points to that really important point that you made, that systemic hormones that treat hot flashes are very different doses from the really low doses used in the vagina. So this question is, do the hormone creams help decrease other menopausal symptoms?
Mm-hmm. Yeah, so the majority, most of the hormone cream is really treatment at the local level. It's minimally absorbed, as I mentioned, perhaps the first few weeks of using it, but then the absorption is minimal or negligent. So people do not have relief of menopausal symptoms such as hot flashes or night sweats, some of the systemic symptoms that they may be having. And in that situation, they have to be evaluated on whether they would also benefit from systemic treatment for their hot flashes.
Great, thank you. And back to you, Marlene. An important question, I think, from an audience member is, when should someone really seek professional help? Mood changes are common for all of us, some anxiety or some blue mood. When should we really seek help? And along that line, there was another interesting question. It's really hard to find a therapist these days. So any suggestions on how to find that help? So when is it indicated and how to find it?
So, I think that, it's really been a message in the media that we're really in a crisis in this country in terms of mental health care. So it can be very difficult to find a psychiatrist or a therapist, and you might seek different providers for different reasons. So a psychiatrist is a medical doctor who specializes in mental health, and a therapist can have many different backgrounds. It could be a psychologist or master's level person. There are also nurse practitioners that are very involved in behavioral health care. There's really an array of different providers. So it's important to know what you're looking for, and also keeping probably an open mind. But I think that if someone is suffering from a psychiatric disorder, like major depressive disorder or an anxiety disorder or something else, part of the definition of those disorders is that the disorder is interfering with functioning. So the person is not able to live their life in some arena, like work-wise, socially, that there's a lot of distress, and so that may be time to see a psychiatrist. And therapist or psychotherapy can be helpful if someone has a psychiatric disorder, but also if someone's experiencing distress due to situations, a lot of stress, and there are different types of psychotherapy. So for more information about how to navigate the resources, I highly recommend the National Alliance for the Mentally Ill, which has a website, which is NAMI.org, and also the Depression and Bipolar Support Alliance, which also has an excellent website. Also, the American Psychiatric Association and the American Psychological Association also have patient and family resource pages. The other thing is primary care doctors and GYNs often have colleagues that they work with and often refer to, and can help navigate the system. But I would say, if you're thinking for yourself or for someone else close to you that you might want to get help, you definitely want to like start looking into it as soon as possible, because sometimes there's a long wait to get help, and it may depend on where you are. And I just want to mention too that especially with the COVID pandemic, there was a lot of shift to telehealth. So you also want to think about whether you want to see someone in person or whether you want to see someone via telehealth. We've seen great benefits of telehealth. Many patients who would not generally engage in psychotherapy or mental health services might engage in telehealth because of being in the privacy of their own home, or because of the convenience, or being not having to take so much time off to travel to and from visits. So that has been a benefit, but there are definitely advantages also of seeing someone in person. So the full assessment, for many psychiatric disorders, patients may need labs or some sort of a physical assessment. So these are all things to keep in mind as you consider seeking care. But what I would strongly suggest is checking out the resources and starting your search on the earlier end. And the one last thing I'll say about resources is that the National Alliance of the Mentally Ill just came out with a book, and I just grabbed it before this talk, and I don't know if you'll be able to see it with my background up, but it's called You Are Not Alone, and it's edited by Ken Duckworth, who is a Boston psychiatrist who has a leadership role in the National Alliance of the Mentally Ill. And it really, spells out, if you're sort of a novice in this area, like really seeking care for the first time in this area, which can be so overwhelming, how do you get started? What types of providers are there? How do you navigate what is often a very confusing system? Really to help people advocate to get the best care possible for themselves and their loved ones.
Thanks so much, Marlene. I think we'll probably have time for one last question, or maybe two for Sujata. I did want to thank everyone for their questions. There are more questions than we'll be able to address. So if your question wasn't addressed, I'm really sorry about that. But Sujata, there's an interesting few questions in here about libido. So, what might be the impact of, treating vaginal dryness on libido, and are there other medications for libido?
Sure. So the first thing I think about when people come in talking about libido is, are they having pain with sex, right? Because if you're having pain with sex, you want to treat that first, because obviously you're not going to be interested in having sex if if it's painful for you. So if they're having pain, the first thing you want to think about is treating that by vaginal estrogens, lubricants, moisturizers, pelvic floor physical therapy, and see if that's really the cause of the problem, and it helps with the symptoms. If you've already done that and there are still concerns about libido, there are a couple of medicines that are available that are FDA approved for premenopausal women. One of them is a pill that one can take every day, and the other one is an injection that you can give yourself up to 8 times a month. So it's FDA recommended up to 8 times a month. So there are certain options, and it certainly is a discussion that you can have with your gynecologist.
Great. Thanks so much, Sujata. And along that line, there were some really interesting questions about systemic hormones. And one of them was, what is the difference between synthetic hormone therapy and bioidentical hormones? And again, it's not really specifically relevant to the wonderful talk you gave today, but I know this is still your area of expertise.
Sure. So systemic hormone therapy is used to treat systemic symptoms, and those would be things like hot flashes and night sweats. What we talked about today was vaginal estrogen therapy for specifically vaginal symptoms or symptoms of the urogenital tract. So none of the medicines that I talked about are going to help with systemic symptoms, and they're not meant for systemic symptoms. In terms of, Jen, I forget what was the second part.
Bioidentical.
Bioidentical, that's right.
Quote, synthetic.
So everything that I mentioned today is really bioidentical, which means that it's estradiol, which is what our ovaries make when they're functioning prior to menopause. There are some synthetic estrogen products, specifically conjugated estrogens, that tend to be synthetic. And there is one cream available to be used in the vagina that is a synthetic estrogen product. There are no synthetic progesterone products that we use in the vagina.
Great. And maybe I might also add, because I think I sense what the questioner is asking, bioidentical hormones, just to begin, is really a marketing term. It is not a medical term. If you're talking about compounded hormone therapy, in general, especially for systemic symptoms, we do tend to discourage the use of compounded hormones. But just as Dr. Somani said, bioidentical, if you think about it as natural, is the same estradiol that your ovaries made when you were younger. I mean, the great news is we do have a lot of those vaginal estrogen products that are all FDA approved bioidenticals. So I think that's the goal, is to stick with the FDA approved bioidenticals. Really wanted to thank both of you for an excellent Q&A session and for great talks. Thanks so much. Really appreciate your joining us today.
Thank you.
And so now I have the pleasure of introducing our third speaker. Dr. Emily Lau is a cardiologist and researcher at the Mass General Hospital Corrigan Minahan Heart Center. And she'll be updating us today on heart healthy approach to midlife. Thanks so much, Emily.